Welcome back, everyone. I'm here now with Dr. Raymond Baule, and he is a board-certified neurosurgeon with Atlantic Neurosurgery, and they are located at 4056 Capitol Drive, right off Sunset Avenue in Rocky Mount. Dr. Baule, thank you so much for being with us.
Thank you.
Dr. Baule, first tell us, I understand you came from California to Rocky Mount. What is it about Rocky Mount that drew you to this area for you and your family to reside and establish a practice?
That is correct. When we moved here, we had a little girl, Alyssa. She was 6 weeks old at the time, and we were looking for some place that we can bring our family to and be comfortable and have a good quality of life. And as far as the practice is concerned, I wanted to be in a setting where I can spend some time with the patients and relate to the patients and have time to take care of the whole patient completely.
Very nice. And correct me if I'm wrong, doctor, but when it comes to neurosurgery, do people often think of neurosurgery as only pertaining to issues involving the brain, when in fact you cover a multitude of things, including the entire nervous system, correct?
That is true. Neurosurgery is typically a surgical discipline which treats structural problems within the nervous system, and this encompasses the brain, the spine, the spinal cord, the spinal column, and the peripheral nerves as well.
So just because you are a neurosurgeon doesn't necessarily mean that everyone who comes into your office has a surgery. They are actually, you treat a lot of things non-surgically, like the neck and the back pain, correct?
That is correct. Throughout neurosurgeons training, which is extensive, we learn to treat spinal disorders, typically neck and back pain, with conservative management, medications. Neurosurgeons are well versed in pain procedures and pain management, and also therapy institution.
One of the things that I found to be very impressive was the fact that you are one of the few people who specialize in the minimally invasive spinal surgery. Tell us a little bit about that procedure.
That is correct. There are various disorders which are easily treated with less invasive procedures, which is really a growing trend in all surgical disciplines in the present day. Typically, patients with disc herniations and osteoporotic compression fractures are easily treated with much, much smaller incisions and much better outcomes and significantly lower risk and complications.
And so being that you specialize in this surgery, do you have people from all over North Carolina visiting you?
Generally, we see patients between Raleigh and the coast. We have patients from Plymouth and Windsor, and also from Zebulon. We have offices in Wilson and also Halifax. So we have patients from the Virginia border, pretty much down south of Wilson.
Dr. Baule, how common are spinal fractures related to osteoporosis?
Well, unfortunately, it is rather common. Osteoporosis is a disorder of the bones, and where the bones lose calcium as we're less young, and because the bones are thin and have less calcium, they're more susceptible to the forces of everyday life. Typically, because the spine is an axis which supports the body, patients develop what's called a compression fracture, where the bone compresses upon itself. And this day and age, there's really no role for not treating this with a procedure, because it will only get worse and can result in chronic pain.
And I also noticed that in addition to having physical effects, people often have psychological effects associated with fractures, like depression and anxiety and just not being able to do what they normally do. Is that correct?
That's true. If you can imagine, everything is interacted with the spine. So if there's pain coming from the spine, everyday activities, which ordinarily seem rather simple, precipitate very severe pain.
Well, that makes sense. And as far as patients coming to see you, do they have to have a referral, or can they just come right into your office?
No, there's only one very small select patient population of insured that requires some form of referral, but actually we can oftentimes get that referral after the fact. And even if a referral is not obtained, it's absolutely not necessary at all to come to the office. Patients can call the office directly, and we're happy to set them up with an appointment, usually within 1 week.
What is it that you like to do in your free time?
Well, as I mentioned earlier, we had one daughter when we moved here. Now we have two daughters.
Oh, great.
Olivia is 4 years old, and Alyssa is 6 years old. And my greatest joy is wrestling with my girls. And I'm usually the one injured.
Oh, that is very funny. Well, Dr. Baule, we thank you so much for being with us today, and it certainly has been informative, I know, for me and perhaps for our viewers as well. If you have any questions for Dr. Baule or about Atlantic Neurosurgery, you can call the number on your screen, or you can also visit our website at www.breakawaytheshow.com. Thank you again, Dr. Baule.
Thank you.
We'll be right back.